You're listening to Bark and Wag's 15-Minute Vet Talk. Each week, your host, Polly Requa, interviews veterinarians and individuals in the pet industry from across the nation answering pet questions. Bark and Wag podcast is produced weekly for your enjoyment, and show notes can be found at barkandwag.com under the podcast tab. That's BARKNWAG.com. Please remember to subscribe to Bark and Wag 15-Minute Vet Talk.
Thank you for listening to Bark and Wag 15-Minute Vet Talk. Bark and Wag is dedicated to protecting our dogs through advocacy, education, and supporting like-minded dog lovers by selling custom pet products. Bark and Wag is excited to announce our new partnership with a Colorado hemp farm to produce a line of CBD products for your pets. Bark and Wag has CBD pet tincture available in 300, 750, 1200, and 2400 milligrams. Bark and Wag CBD is pet safe, no THC, it's made in the USA, and is CO2 extracted. Please check out Bark and Wag's website, barkandwag.com. That is BARK, to see our line of CBD and awesome merchandise. We love pooch ideas for podcasts and merchandise, so anytime send an email to Polly at barkandwag.com with your suggestions.
Welcome to Bark and Wag 15-Minute Vet Talk. I'm your host, Polly Requa. Today we're talking to Dr. Laura Brown, owner of Green Tree Animal Hospital in Libertyville, Illinois. Welcome, Dr. Brown.
Hi, Polly. Thanks for having me.
Well, thanks for being on the podcast. Today we have a listener question. So Chuck the Pug, our pug, is on social media.
Yes.
And one of his friends, Cinnamon, is ill.
Okay.
And Cinnamon has a soft tissue sarcoma in her left leg, and it's metastasized to the lung. And the question is, the owner is looking for medications or natural solutions that are good for dogs with cancer. She has some suggestions for CBD, Benadryl, and turmeric, but she wanted to find out what might be best for Cinnamon, especially with swelling and pain, and possibly delaying the growth of the tumor.
Okay. So first of all, soft tissue sarcomas are frustrating. They typically are pretty locally aggressive. And so one question that we might not have the answer for today is to find out if Cinnamon actually had a surgery that removed the tumor once and got the histopathology back. So that's how we know it's a soft tissue sarcoma. Those tumors are tough to get complete margins on because they're typically in areas that don't have a lot of extra skin, sort of like a leg. And they typically have sort of hidden fingers. They, microscopically can send their cells out farther than you think when you're taking the primary tumor off. And they typically can be embedded in muscle and things like that. So it's hard to remove the whole tumor. Okay. So that, surgery is usually the first step in treatment and diagnostics. We call it excisional biopsies in dogs. When a bump pops up and we're worried about it, we want to find out what it is. We want to biopsy it. But to do that, we need to get a decent chunk of the tissue. Sometimes we try and do what's called a fine needle aspirate, where you can do it in the office in front of the owner. You stick a needle in and suck some cells out and spray it on a slide and try and identify the lump that way. But it's limited in soft tissue sarcomas are hard to diagnose that way because they don't shed their cells very good. It's also a really small sampling. So based on the location, based on the feel of the tumor, based on how fast they grow, things like that, how firm they are, how attached they are, we typically end up at surgery for an excisional biopsy, meaning we're trying to take as much off as we can to help with the cure. And therefore, then we send the whole thing we take off to the pathologist for the diagnosis, right? Does that make sense?
Yep.
And we still want to, we don't want to cause disfigurement with the first surgery. So we do the best we can to get the biggest amount of tumor out, close it up, and have minimal post-op problems with the incision. That being said, once you get the diagnosis of soft tissue sarcoma, they're frustrating in that there's potentially little fingers in there that we didn't see, didn't get, and how are we going to prevent it from growing back? So that is one tumor that does best with radiation therapy to kill any cells that were left behind and try and prevent reoccurrence.
Okay.
Then radiation therapy can be very palliative in helping shrink the tissue, therefore the swelling, and therefore provide some pain relief. So that's not easily accessible. No general practitioners do radiation therapy. That's always a specialist oncology treatment.
Okay.
But that being said, there's some really cool things that can happen with radiation in dogs and cures. But it's usually fairly expensive, and the dogs have to be sedated / anesthetized to get their radiation treatment because the radiation is so targeted to the location of the tumor that they can't move a muscle to make sure the radiation goes in the right spot.
So would you be treating the leg or would you be treating the lung?
So the leg would be the first place.
The leg.
And I implied from the question about cinnamon that the swelling and problem is at the leg level.
Oh, I see. Okay.
I could be wrong about that. The sad part about cinnamon is once it's metastasized, very, very rarely do we go into surgery and take out the lung mass.
Sure. Yeah.
Not to say it hasn't been done, but.
Right. No, I was just going to say with Chuck the Pug Sr., he had almost like he had a melanoma in his mouth that was kind of dormant, but was on a watch. And then it spread to his lung.
Right. The lung is a target area for metastasis for lots and lots of tumors.
Okay.
So, because it has such a good blood supply. So once it gets there, then you have to decide, and unfortunately soft tissue sarcomas don't have a great chemotherapy response. There are no, there's not a great oral medication or injectable medication that I'm aware of that works as well as radiation. That's different for other kinds of cancers in dogs. But I also think one thing to be said about cancer in dogs versus people immediately think I'm never, ever going to do chemo on my dog because they had a family member that suffered and had horrible side effects to chemo. Dogs are different. So here's the other place to say is Cinnamon's owner, I strongly encourage you to go see a dog oncologist. I'm just a regular GP. I don't have all the answers about every kind of cancer, but that's what an oncologist for dogs is.
Okay.
And that's where potentially you will find radiation treatments and chemotherapy options, even, once you go and have the consult. Doesn't mean you have to choose them, but going to see them for a consult is huge for reasons, for prognosis reasons, for cost of these therapies, how, what are the odds they'll do well with it or without, you know what I mean? And to help you make some good quality of life decisions around how far do you want to go with Cinnamon's care.
Well, and also I'm sure the oncologist has some pain medication.
Yeah. I mean, there's always, the non-steroidal anti-inflammatories are helpful, and especially in some tumors, they've been shown to have some anti-tumor effects. There's a drug called gabapentin that's very good for all kinds of pain that you can give with non-steroidals. And so your GP should be able to help you with that kind of medication if you want to just do palliative pain control, for sure. Your GP I could do that for my patients that have cancer and have chosen not to seek care with the oncologist.
It's always good to go through the whole process because, this is different than what's going on with Cinnamon, but with Chuck the Pug, when he was having trouble breathing and, blah, 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 I went to a specialist and they said, well, we have to put these tubes in his nose and we could puncture his brain. And I was like, no, we're not doing that.
Yeah,
you kind of have to go through the process to be like, all right, we're gung-ho, we're going to do this, we're going to fight it, or we're going to be like, no, this is not my dog. My dog does not want to go through this.
Right. And so think of it as a second opinion, right? Like there's no veterinarian would deny anyone a second opinion. We are all about, you know what I mean? And I don't, once again, I'm a GP. I don't treat soft tissue sarcoma other than potentially getting the biopsy done first so we know what we're dealing with. and then referring them to an oncologist who has all that special, that's what they do every single day of the week. I treat ears and atopic dermatitis every day, and I still send people to the dermatologist. But cancer is a whole different ballgame because there's a bazillion different kinds of cancers out there, and they all have different medicines to treat them.
Right. So, okay.
Yeah.
Well, I will definitely post this podcast, hopefully maybe this week, and let Cinnamon's parents know what the suggestion that the next step is to see an oncologist.
Yeah. And I think Cinnamon's mom asked about holistic things ultimately as well. And I don't want to brush that under the table. I personally don't know a ton about turmeric. It's a very anti-inflammatory product people take sometimes for inflammation. I don't know much about it in dogs or the dose to use. CBD, same. You got to be careful on the products that you use. Polly, you can speak to that. They're not, you have to make sure they have no THC in them, and you have to, make sure the milligram, I don't even know what milligrams to say is safe for a dog to use for cancer. There are some other anti-cancer or holistic things out there, some mushrooms, there's some other things, but some of those have been tested for specific cancers too, not just a broad treatment for any kind of cancer.
Right.
So you have to be careful trying some of that holistic stuff. There are definitely holistic veterinarians. That's their specialty. Reach out to one of them because they have Chinese herbs and they know way more than I do about it. I don't want to brush that under the rug, but there are veterinarians that specialize in that kind of treatment as well. So whether it's, you want to see a regular oncologist, like a Western medicine oncologist, or you want to seek out a holistic veterinarian, either way is a good option for a second opinion.
Yeah. Right. Okay, good.
Yeah.
All right. Well, thanks for answering that question. And we certainly look forward to having you back on the podcast.
Thanks, Polly. Me too. Hope to talk to you soon.
Thank you for listening to Bark and Wag's 15-Minute Vet Talk. If you like what you just heard, we hope you'll pass along our web address, www.barkandwag.com, to your friends and other pet owners. Have a pressing question for a veterinarian? Ask your question at barkandwag.com under the podcast tab. This has been a KFR production. Join us next time for another edition of Bark and Wag's 15-Minute Vet Talk.